I call this meeting to order. Welcome to meeting number 16 of the House of Commons Standing Committee on Health. Today we meet in public to plan our future business up until the end of June. Today's meeting is taking place in a hybrid format pursuant to the House Order of November 25th, 2021, pursuant to the directive of the Board of Eternal Economy of March 10th, 2022. All those attending the meeting in person must wear a mask except for members who are at their place during proceedings. And I guess all we have here today is members at their place during the proceedings. But before we begin, Monsieur Jean-Denis Garon from the Bloc, I understand is with us today, along with Mr. Thériault. And I also understand that he's going to be replacing Mr. Thériault until the end of June. So in the interest of maintaining a good collaborative environment around this table, I would suggest that the committee allow Monsieur Garon to receive all of the committee distributions and be granted access to the digital binder until the House sits again in September, or there's a membership change that renders it unnecessary. Is that, do we have consensus on that?
Yes.
Thank you. Okay, so I now want to bring the committee's attention to the proposed calendar that was circulated by the clerk and analyst, and I'm hoping that that will serve as a starting point for our discussions. It's been distributed to members and staff in both languages. The clerk and analysts have inserted some deadlines for various items, some of which would have knock-on effects if they change. For example, the dates relating to the workforce report really are not flexible unless we cut meetings on that study in order to get the report done and report it to the House by the end of June. Translation and publications are dealing with many other reports, so we have to ensure that they have time to do their work and that we still are able to present it to the House in a timely fashion. In any case, the clerk can advise us on the potential consequences of any changes we discuss. So if you have the calendar in front of you, that should form the starting basis for our discussions. And I don't have anything more to say except to open the floor and recognize Mr. Barrett.
Okay, thanks very much, Chair. And I just note, as I'm sure the clerk has for you, that Mr. Lake is seeking your attention following mine. So we have a pretty short window remaining for us before the end of June, and it's a beautiful day outside, so I'm sure our minds are all turning towards nicer weather and the like. So I'll try and be brief in the interest that maybe we're not here until after sunset. There was a commitment made by this committee before I was named to this committee that 50% of our meetings would be dedicated to our study of COVID, and I think that we're at a point right now in the ever-changing COVID landscape that I have a couple of thoughts that I'd just like to share for consideration. One is that we're on the eve of a 2-week constituency break, and following the constituency break, we'll have had several weeks where the what's being described as the 6th wave of COVID, or the Omicron 2, or the latest subvariant has been circulating in our communities. So that will have been happening for several weeks. Many of the provincial restrictions will have been lifted for more than a month. I would suggest for consideration that on return, that our next meeting on the COVID pandemic, that we hear from federal experts like Drs. Tam and New and other representatives of the Public Health Agency of Canada to update us on the federal picture. The other thing with respect to the COVID studies, those meetings, again, before I was named to the committee, there were discussions about a study on children's health. And so I'd be interested to hear from committee members if we would focus on a new study on children's health, or if we would combine the interest of that study with the COVID study, the effects of COVID on children, and continue that as making up part of those 50% meetings. And a third option would be, and I'm not moving a motion at this time, Chair, would be that we have a separate study that could occur during those time slots that would have otherwise been allocated to meetings on COVID that would concern children's health, including the effects of COVID on children. And so I think that would satisfy two competing and important interests. And then there's the matter of the other the remaining time that we have with our health human resource study. And I would just ask, if we have desire and witnesses to proceed with the originally intended number of meetings, or if committee members would, if there would be consensus to more quickly move to drafting instructions for our analysts, and then that report could inform our work going forward, and that perhaps the other important issues facing this committee, like the potential of a study on the opioid epidemic and the potential of a private member's bill coming forward from Mr. Johns that's expected to be studied at this committee, if that would be how much bandwidth that would take up. So those are just some thoughts and highlight our broad priorities. I'll let Mr. Lake speak to one additional issue, but those are the areas that I would hope we can find some consensus over the course of this meeting. Thanks, Mr. Chair.
Okay, thank you, Mr. Lake, or Mr. Barrett. We're going to hear from Mr. Lake, and you've raised a bunch of issues here. Once we hear from Mr. Lake, if we can perhaps take them on one by one. Mr. Lake, you have the floor.
Yeah, I'm going to just use the opportunity to quickly raise an issue that everybody's aware of. I'm not even going to give a big preamble into it. Everybody voted on this, and we voted unanimously in the House in the previous Parliament. So I'm going to move a motion that, pursuant to Standing Order 108.2, and in relation to the motion unanimously passed by the House of Commons on December 11th, 2020, calling for a national 3-digit suicide prevention hotline, 988, the committee hold a minimum of 3 meetings to study the implementation of this hotline, that the Minister of Mental Health and Addictions be invited to appear at one of these meetings, and that the committee present a comprehensive report to the House.
Thank you, Mr. Lake. The motion is in order, and so the debate is now on the motion. I see Mr. Davies with his hand up virtually. So let's go to Mr. Davies and then Mr. Van Koeverden.
Thank you, Mr. Chair. And thank you to my colleagues for raising this. There was kind of a lot to unpack there because of Mr. Barrett's previous comments. My sense is I don't see any real reason to deviate from the work plan that was adopted unanimously by this committee not that long ago. We're nearing the end of our study on the healthcare human resources crisis. The number one priority that was identified by the Conservative members of this committee was to study children's health. And I note that the work plan that's been placed before us today follows exactly that plan that had been agreed to by, I believe unanimously by this committee only, I think a month and a half or 2 months ago. In terms of hearing from specified people, we agreed that between now and the end of June, before we rise, that we would dedicate one meeting to a study and one meeting to COVID. And I think that was prudent then. And I think it was prescient and even more important now, because as we correctly, at least some of us, I guess, correctly surmised, we're not done with COVID. In fact, I think, as Mr. Barrett mentioned, we are, I think, very clearly now into a sixth wave. The BA2, Omicron BA2 variant is raging through Asia and Europe. There's now the emergence of a new strain, a new immune escape variant called Deltacron. And of course, just in Ottawa, where some of us are today, the wastewater levels are very, very high, and case counts are going up like crazy. So, to anybody who's paying attention to the data, their COVID, the COVID pandemic is very, very much, I would say, the number one health issue dominating us. So, our committee, as the health committee, we must be devoting one meeting a week, I think, at least until June. So why I say that is, in terms of trying to prescribe witnesses, every party has the ability to put forth witnesses.
Point of order,
that they
Mr.
want
Chair.
Yes, Mr. Lake, go ahead.
I think the idea was to move this motion. My hope, and it's on the suicide, I think the motion on the floor right now is regarding whether to accept 3 meetings on a suicide prevention hotline. My hope is just to, hopefully we get full agreement and we can dispose of this quickly and get on to talking about the rest of the business of the committee.
It's not really a point of order, but a point of debate. Go ahead, Mr. Davies.
Thank you. Well, it's funny. We're talking about the agenda. This is the meeting. The topic of this meeting is committee business, and we're talking about how best to allocate our time. And of course, prior to Mr. Lake moving his motion, there were a number of comments made by his colleague that I'm responding to at the same time, because it all amounts to how we're going to best use our committee's time. And in terms of calling witnesses, what I would suggest to Conservatives is, if they want to hear from a particular witness, whether that's the minister or whether that's Dr. Tam or whoever they want, they have the full ability to put that on their witness list and have that person come forward. So I don't see any reason to deviate from the plan that this committee has adopted between now and June, which centers COVID and then centers the 2 studies, one of which we're almost finished and one which was identified by the Conservatives. So I'm not sure where we would have time to put in another study on the suicide prevention number, which I agree is a laudable thing. I'm not even sure why we need to study it, because I'm pretty sure that everybody agrees with it. But our time is allotted right through to the end of June already, and that does not take into account legislation that could be coming to this committee, which I'm sure there is one. In fact, yes, this week we debated C-224, which is the bill introduced about cancers in the firefighting sector. And I anticipate that that's going to pass, judging by the debate, and I anticipate it'll come to our committee. So for all of those reasons, I don't think we need to be passing more motions on studies at this point. I think we should deal with the business that we have already before the committee, which is a full plate. And perhaps when we get to the beginning of June, we can have a full meeting on committee business, and we can maybe start planning our agenda for the fall. Where I'll conclude, Mr. Chair, is I know I've had conversations with my Conservative colleagues who don't necessarily agree with this as an equitable way to deal with things, but I noticed that 3 studies have already been approved, one from each party, Liberal, Conservatives, and Bloc. There has not been one yet agreed to that the New Democrats have put forward to. I'm going to be doing that, and I'm going to be pressing, in the interest of equity, that each of us has an opportunity to put a subject before the committee that of course receives majority support. So before we entertain the Conservatives' second study, I will be looking to conclude the Liberals bloc, New Democrats and Conservatives, before we start getting to Conservatives' second priority, before some parties have had a chance to even have one. Thank you, Mr. Chair.
Thank you, Mr. Davies. Mr. Vancouver, then, please.
Thank you, Mr. Chair. As my colleague from as my colleague from the NDP mentioned, it's a lot to unpack, but so a couple of things. first on determining whether or not we are going to keep going forward with half COVID meetings. I don't think we have to make that decision today because I think that in a couple of weeks when we come back, we don't know exactly what COVID's going to look like. It could be continuing to rise, could be a little bit better. So why don't we make that decision in a couple of weeks when we come back? I also agree with Mr. Davies that he hasn't had a chance to put anything forward yet. So I would like to hear, an idea. We can discuss the order of them later. I think Mr. Lake's recommendation of putting this on the agenda is a good one and valid. And it doesn't necessarily mean, if I'm correct, Mr. Lake, that we study it next. It just means that we're going to. And I agree that it warrants study. And I also, for those members who weren't present, the child health study was one that we all agreed on, but it was from MP Berthold. And so MP Davies is correct that it's a conservative one, but I think it's one that we all kind of would like to do. And on child health, we all agree and we'd like to get to it. And I agree that we don't have to necessarily, I've been finding it a little bit confusing sometimes to toggle between COVID and non-COVID when oftentimes the non-COVID ones, like COVID's a forever thing. We're always going to talk about COVID, so we might as well just, have fewer topical meetings. So on that, Mr. Lake asked that I just move an amendment to make it 2 meetings rather than 3 on 988. And for clarity to my colleague from the NDP, that doesn't mean that we're going to do it before your idea. And I hear you loud and clear that you haven't had a chance to put anything on the agenda yet, and we're all eager to hear what that might be. Thank you, Mr. Chair.
Thank you, Mr. Van Couverden. So we have an amendment to Mr. Lake's motion to change the number of meetings for the study from 3 to 2. So that the amendment is in order and the debate is now on the amendment. And next we have Mr. Johari.
Okay, thank you, Mr. Chair. So the fact that an amendment has been tabled by my colleague, Mr. Van Couverden, means that we're actually debating the motion that our colleague, Mr. Lake, put forward regarding the emergency phone line, so hotline. So I just need a clarification. Are we on the motion that Mr. Lake put forward, and now we have an amendment to the motion, and when we are voting on that, we are specifically debating and voting on the motion and therefore the amendment to the motion? Or now we have broadened the scope and we are talking about other studies? Because I believe the intervention that our colleague MP Barrett made was an opening remarks by our Conservative colleague. The specific motion that were moved by our colleague MP Lake, and that had a very specific scope. And I think we're on, at least my understanding was we're debating that motion. And I believe that assumption proved to be fact when our colleague MP Van Couverden moved an amendment to that motion. So I'd like to get some clarification, and I'll be personally supporting the amendment as well as the motion that's been put forward for the emergency hotline. Thank you.
Well, you're exactly right, Mr. Johari. The debate presently is on the amendment to Mr. Lake's motion presented by Mr. Van Couverden to amend the motion so that it calls for 2 meetings instead of 3. So that's the subject of the debate now. We're going to go to Mr. Lake, please.
I want to say that I accept the amendment. Just to be very clear.
Okay, is there any other, I don't see any other speakers on the list. No further speakers. Are we ready for the vote? Is it the will of the committee to amend Mr. Lake's motion from 3 meetings to 2? I see consensus in the room. So we're now on to the main motion. Is there any further debate on the main motion? Seeing none, looks like we got a bunch of thumbs up. Okay, I will take that as consent or consensus for the motion to be adopted by the committee as amended. Mr. Barrett.
Okay, thanks very much, Chair. So just a couple of things. So with respect to the agenda or the proposed calendar that we have in front of us, it is a proposed calendar. And my opening remarks were not intended to be adversarial. What I was looking to do was find a way to incorporate priorities put forward by all parties. And so with respect to Mr. Davies looking to advance an NDP priority, if that's how we're drawing lines out here, my intention with having the children's health issues potentially studied during COVID meetings was to free up meeting time so that a private member's bill put forward by an NDP member would have white space in our calendar. So because I think that the children's health is a nonpartisan issue, and I think that the opioid crisis is a nonpartisan issue, and that we should be able to find time in our calendar to do those. So I'm not looking to put, I moved no motion because I'm not looking to put forward a conservative proposal. I'm looking forward to find a way for the committee to advance our shared interests for the health of all Canadians. So I would just reiterate that in my initial statement and now, I'm not moving a motion. My intent is that we find a way to free up what is very limited committee time, and that was my intention with respect to comments on children's health. And yes, the committee did agree to it. It may have been unanimous. The committee can also change its mind. But I think it's also prudent when we do have limited resources and we have issues that are extremely pressing and are emergencies that affect every community in every riding across this country, like the opioid crisis, that we find a way to fit it into our schedule. I think that's important. I think that there's ways that we can always improve on, especially after we have time to reflect on items that are in front of us. And we have the study that's on medical devices, specifically breast implants. That also opens up the possibilities, particularly when we have a Cancer Awareness Month, that we talk about the full picture on breast health. Again, because that was an issue that was raised by colleagues in multiple parties, again, before I was at this table. So I just offer all of those genuinely in the spirit of collaboration and am open to hearing motions from all members and would turn my undivided attention to them, but my intention is to find a way that we can collaboratively address all of our priorities, because they're all very important and they don't necessarily need to be competing priorities. They can be shared priorities if that's the way we want to frame them. I think that might be a productive way to move forward.
Thank you, Mr. Barrett. Dr. Hanley, and then Mr. Davies.
Thank you, and I really appreciate. Are we allowed to use names in committee? Mr. Barrett's intervention. There are, I think, three things I wanted to say. One is if the opioid study were, or the private member's bill from Mr. Johns were to go to committee, my understanding is that it would go to justice, but perhaps the clerk could clarify, and I would be more than happy if it came to health. Excuse me. Okay. So perhaps clarification, and if it went to both committees, if it were passed, I would also be delighted. So, but I think some clarification would be helpful in that regard. Personally, my preference would be to keep COVID and children's health separate, but to clarify how much timing is needed for each. I think it's valid to have a meeting in 3 weeks' time and to determine the frequency. My personal feeling is that COVID can probably be dealt with 1 and 4 rather than 1 and 2, and that would open up the schedule for some of these other important areas. I would also suggest that perhaps the children's health I think we need to go back to I remember Mr. Berthold speaking quite passionately about the need for 6 studies for children's health, and that a lot of it would be around mental health, a lot of it would be around the backlog of children's health. But it might be useful to revisit the premise for that, and then perhaps recommend on the number of studies needed, whether 4 or 6. So I think some discussion between 4 and 6 may be useful to allow us to handle the calendar efficiently. Thanks.
Thank you, Dr. Hanley. I'm advised by the clerk that it's not necessarily predetermined as to where that private member's bill will go. It's actually a decision to be made by the House as to which committee it's referred to. Mr. Davies, please.
Thank you, Mr. Chair. Well, I appreciate Mr. Barrett's clarifications. I'm not sure that I disagree with anything that he said. There's no question that the committee can revisit our schedule at any one time. I guess the question I have in my mind is the subject of this meeting was based on a circulated agenda and schedule that was sent around, which I took the time to read and study. And what it does is it reflects the agenda that's been made by this committee, like I said, maybe 60 days ago, that I think already deals with some really important subjects. We're obviously in 2/3 of the way through the healthcare human resources crisis study, and children's health, I think, is absolutely laudable goal. In fact, I think the product of our discussion was we even amended a bit to include something that I wanted to talk about, which was the school nutrition aspect or food security of children, and that was graciously passed by the committee. Look, there's 10,000 issues in health, and there's about 700 number one priorities. They're all important. But I think that it's somewhat disingenuous to suggest that there's no sense of prioritization or even preference depending on parties. I mean, my priorities may not be the same as the Conservative priorities, may not be the same as the Liberal or the Bloc's priorities. That's not to say that all of the issues aren't important. It's just, it reflects different senses of prioritization. So when I say that there hasn't been a subject that I consider to have been generated by us, it's not that I view the subjects that have been agreed to study as unimportant or unworthy of study, but just that they don't reflect necessarily my priorities. For instance, I wanted to study dental care. I wanted to study the substance use, the opioid overdose and substance use crisis. I'd like to study women's health. I'd like to study Indigenous health. I'd like to study breast health. And on that point, to respond to Mr. Barrett, in fairness to me, wasn't here, when the Bloc Québécois put forth their motion to study medical devices or breast implants, I tried to amend that motion to be a broader look at breast health generally, and that did not happen. So I'd be absolutely thrilled to broaden that subject to look at breast health generally. But one of the reasons I think we've allocated only 2 meetings to that Bloc Québécois generated subject was because it would be limited to medical devices. In other words, a federal breast implant registry is my understanding. If it were to look at breast health generally, we'd need more than 2 meetings. So back to the point at hand, I think really what we need to do to be most productive is we have a calendar in front of us. I've studied it. I think it's a good one. I think there's a couple of things that strike me about it. One is that, and it goes back to, I'll say this, I do think we need to study COVID every week. For the reasons I said, I won't belabor them. But I will say as well that in terms of COVID in children or COVID in any other aspect, the subject is completely broad. Every party can put forth witnesses on any aspect of COVID they want. So if say the Conservatives in this case would like to explore the impact of COVID on children, then they're certainly free to call witnesses who can speak to that. There's dozens and dozens of angles on COVID, and I would not want to restrict it, particularly as Mr. Van Couverden said, we probably have to get to first name basis in committees, but I'm going to start using first names if that's okay. You can certainly use mine. As Adam said, COVID being so fluid, who knows 3 weeks from now what the where this virus is going and what we'll need to focus on. And I think that's one of the advantages of keeping a watching brief on it, is we are flexible, and we are, to be able to respond to the latest, change in COVID. Maybe there'll be a discovery 3 weeks from now of a treatment. We may want to explore that, for example. So my last point on the calendar is I think it's good the way it is. Other than I noticed that there seems to be, for a number of meetings on the children's health study, there's a Monday and a Wednesday, Wednesday that say either COVID or children's health. If we agree to stay the course as we've decided before and keep one of those meetings every week on COVID, then that means that the children's health dates will be bumped further. And by my reckoning, that what will get done by June is basically we'll finish the study on human resources, healthcare human resources, and hopefully we'll finish the study on children's health. That then leaves consideration for the other motions that we pass, including the one Mike just moved, to put in the mix for what we look at in the fall. But I don't see how we can look at anything other than children's health or finishing off the HR study, then children's health and COVID between now and the end of June. And that's assuming that we don't get knocked off our agenda by, as I said earlier, legislation or other issues that may come up. Thanks, Mr. Chair.
Thank you, Mr. Davies, Dr. Ellis, and then Mr. Lake.
Thank you, Mr. Chair, and thank my colleagues for their interesting comments. Certainly I think that the difficulty with continuing on with COVID once a week, every week, is that really we're not gaining any more insight into the disease itself. I would suggest that instead of the committee actually guiding the study, those folks who show up as witnesses are beginning to guide it. And I don't think that's really the intent of what we're here to do. I think it's rather unfocused, and given that, I think that makes it very, very unfortunate, and continuing to belabor a point that, yes, it's bad, and yes, we should all be immunized, and et cetera, et cetera. I don't think that we're gaining knowledge, and I don't think that's in the best interest in the Canadians that we're trying to serve here. So given that, we also have this significant responsibility going forward to children, I would suggest that using some of the time to be determined by this committee on children's health, and especially those effects. I have to tell everybody that Monsieur Boltold and myself had a meeting with the Canadian Pediatric Society. Their concerns around children's health with respect to COVID is significant. And one of the things that I know my medical colleagues will echo with me is we have to continue to remember that children are not simply little adults, and the effects that COVID has had on children could be astronomical, and they're heretofore unknown. And I think that we need to begin to hear from experts around that, because it's also a subject that we haven't heard much about in the public, other than the fact that, should they be wearing masks or not, et cetera, those kinds of things. There's a multitude of things that need to be unpacked with respect to children and COVID, and then if we go on and we add other aspects to a child health study, then again, we need 50 months to study children's health alone. So my point, I guess, to bring back to the middle is I really believe that we are rather unfocused with respect to COVID. I would echo my comment, Mr. Barrett's comments, in the sense that, I think we need an update after our 2 weeks of constituency time. That would, and Mr. Van Couverden as well, that would help us better understand where we are with COVID. If COVID is rampant, though, I guess the question is us studying it more going to be any more helpful? I'm not convinced that it is. If it's more rampant, then we have to look at what measures are going to help make it less rampant. I mean, this is not rocket science here. So studying it more, I don't think is going to help it. And so that devoting some of that time specifically to children in whom we have no idea of the consequences. And we, sorry, I shouldn't say that. We heard a little bit about that from the speech language pathologists when we talked about reduced rates of children speaking and reduced literacy in children as well. So I think that we need to be very cognizant. We owe that to the next generation of Canadians that are coming along. As I said, they're not just little adults, so I think that we need to be very, very aware that Canadians are counting on us to look at that. I think the other thing that's important in this committee is I thought we got beyond the difficulties that we had early on. We showed a little bit of flexibility in terms of saying, hey, you want to add on to this study? Great. Let's add on to that study as well. And I'm certainly happy to look at that. I don't think that we can go wrong if we want to look at and certainly I do not speak for the bloc, but we look at the medical device study and we make it a larger study in terms of looking at breast health overall. I think that that's something all of us could get behind, and I know I don't speak for everybody, but I think those points are germane. I would also, though, echo Don's comments in the sense to say we do have a very full calendar, and I think that being said, it's very, very important that we understand how then can we free up some time. And my overall comment with respect to that was let's reduce the amount of time we spend looking at COVID because we're not gaining any traction with respect to that, and we have other very, very important things to study. So thank you all for listening. Appreciate it.
Thank you, Dr. Ellis. Next, Mr. Lake, and then Mr. Van Couverden.
Yeah, I mean, what I fear is that we're going to get in this interminable loop of conversations in sort of committee business planning. I think we've got to take some action here. And Don, with respect, you had the floor and an opportunity to put forward one of your motions. Right now, as we're sitting here discussing the committee plan, there is no NDP motion actually to even discuss in the mix because you haven't moved one yet. And so I'd like to hear because I think you got 4 at least on the notice paper for our committee. We'd like to hear what the NDP priority is because we don't know right now. And that would be helpful to the discussion as we're, discussing what's on the table. Right now, I think we have 4 or 5 motions that we've passed that are on the table for discussion. And it would be helpful to know what the NDP priority is. And, I'd like to move forward. I do, again, join the consensus that seems to be emerging around having officials come especially 3 weeks from now. I really do think it's going to be important for us to get a lay of the land as we decide how we're going to move forward, as a committee. And we may decide that we want to dedicate more time to COVID, or we may decide, as some have suggested, that may be redundant to other briefings, public information that's out there. But we have to put something on the table. And I really, I do think that dedicating 2 meetings to the suicide prevention hotline, it is something that would be, and I'm not saying when it should be, but I think it should be prioritized because it's something that this committee can actually shed some light on. It's been a long time since we passed that unanimous consent motion. The debate didn't end when we passed the unanimous consent motion because there's been 0 action on it up to this point. And I think it's incumbent on us as a health committee. We make the argument that mental health is health. It's incumbent on us when we have an opportunity to shine a light on why something is delayed or taking so long. It's incumbent on us to do that. And we have this opportunity for an investment of 2 meetings to bring the minister, but also to have the CRTC come. The minister's pointed to the CRTC as the reason why we can't get a hotline, passed and put in motion. It's a chance to call them as a witness and hear from them and ask questions and have a public discussion and some of our expert stakeholders around what's taking so long. Maybe there's a really good reason, and as a committee, it would be good to understand that as parliamentarians from all sides on something that we unanimously agree on. So I'll throw that out there, but I really do, Don, look forward to hearing which of the different motions you have on notice you would like to put into the mix.
Thank you, Mr. Lake. Mr. Van Couverden, please.
Thank you, Mr. Chair. I think we are more or less all agreeing right now, and we're just doing it in a political way where we're kind of asserting ourselves a little bit, which is fine. We're politicians. But to my understanding, There are about 16 meetings, up to 16 meetings left between now and when we rise in June. And to my understanding, the 25th and the 27th would complete our human resources and healthcare study. And then on the 2nd, we could have a briefing from the Public Health Agency of Canada, at which time we can then determine how many COVID meetings we need going forward. There are a lot of things that could arise and we don't know what they are, and we don't need to make that decision between now and May, so we might as well not. The next meetings could be all children's health, they could be a mix, they could be 50-50. We can do that later, but I also don't think we have to concern ourselves too much. We can, and I'm interested to hear from Dawn, as everybody else is, with what we're going to study in September today.
Thank you, Mr. Van Couverden. Next, Dr. Hanley, and then Mr. Davies.
Yeah, thanks. I'm just trying to digest what Mr. Van Couverden just said and how that all merges, or what Adam just said. But I want to go back to Dr. Ellis's comments because I actually agree. I think we could use COVID time, and this is different from what I said before. But I think if we include effect of COVID on children as part of the COVID studies, it will allow us to kind of catch up on some of that efficiency and hopefully fit in Mr. Lake's studies. And I think that would allow us to keep moving. Then we could always pivot if we needed to, if something bad happens with COVID and we really need to discuss it, we could pivot and move the child health studies along. So it could also be useful, and again, not to throw too many things into this, but it could also be useful to move the healthcare workforce, one of those studies, so that we have a COVID catch up, as it were, the first week back, and then will allow us to plan from there on.
Thank you. Mr. Davies, please.
Well, thank you, Mr. Chair. Well, geez, I'm flattered at all the interest in hearing what my priorities are, and I absolutely will look forward to putting those forward. To be quite frank, the reason that I haven't moved any motions on a study right now is because, like I said, we had a fulsome debate, a month or two ago, and set the calendar to June. That's why I didn't move any motion today. And, I think what we're doing today is really we're re-examining a schedule that's already been set. Again, I haven't heard anything that would cause me to disrupt the agreement that we came to about the schedule between now and June, as important as they are. The other thing is that it's a little bit premature a bit for me, because 3 of my motions, one of them was to study substance abuse and addiction, but of course, with my colleague, Mr. Johns, advancing a bill before the House that deals with that subject, if that passes, and it will be coming up for a vote, I understand, in May, it'll be going to a committee for study, whether that's ours or Justice. So that's why I've held off on that. The issue on childhood nutrition, which was another motion I moved, has been kind of incorporated into the motion that we passed on children's health. So that's been subsumed. And I have one on breast health that is still on the books. But I just thought it was premature to be talking about the fall. So I'll certainly revisit and move some more motions. And then at a certain point, I'll give all of my colleagues a heads up about which one I would like to proceed with in due course, but I don't think we have to decide that today. And again, I'm pretty sure that we're going to have a meeting in early June to see where we're at, because we may not be finished the children's health issue by June as well. So, I don't think we need to set October and November's calendar here at the first week of April. So I still think that the calendar that we have as we've set is it's broad enough to encompass the concerns of everybody that I've heard today. I must say that I don't think that having a watching brief on COVID is a waste of time, or that we're not learning anything at all. I think there's a lot of aspects of this that are still fascinating. For instance, where are we at in terms of domestic vaccine production? You know, we're coming to the end of our boosting. We've heard some evidence about boosting not being a viable long-term issue, or I'm sorry, mechanism of dealing with this. You know, we have 45% uptake on boosters. What are the impacts of children? I'll tell you one thing I'm hearing a lot about now is long COVID, which our committee has not heard, I don't think, any testimony on. Like I could list 25 different aspects of COVID right now that are current, pressing, important to Canadians, and that the committee hasn't plumbed yet. So I must say for the record that I can't agree with any of my colleagues who suggest that studying COVID is a waste of time or that we have nothing left to learn. So plenty of, and I'm happy if anybody is running out of witnesses to put forward, just fire them over to me and I'm happy to fill up the witness spots because I got a million of them to put forward if we need to. So I think we should just stay the course. Again, I think we should, if we stay with COVID being once a week, that gives everybody the flexibility to call witnesses on any aspect that they wish, including on children. And then we can finish off these two very important studies, which is on human resources and on children's health. And you know, maybe we can squeeze in the Bloc Québécois study. I'm not optimistic that can be done before June, but we could. And Mr. Lake's excellent suggestion on the suicide prevention hotline is something that obviously we can get at in the fall. I mean, I have reason to suspect that may be legislated. I mean, before we study it because of the unanimous agreement that we had in the House for that idea. So anyway, I just think that given the volatility of COVID, I don't think it's worthwhile planning much beyond June at this point. So I think what we should do is just agree to adopt the current calendar as we have it and finish that off and be nimble if we have to over the weeks and months ahead.
Thank you, Mr. Davies. Mr. Johari, please.
Thank you, Mr. Chair. First of all, I agree with what Dr. Ellis talked about, that from this angle, when we look from the lens that we've been looking at COVID so far, we have got all the information. And with the fact that when we're coming back, we're going to have officials coming back and giving us an update so we can plan going forward, that really makes sense. Also, I think there is an agreement on how we should move forward. It's just what those studies are going to be is I think it's a little bit of a different approach. So I don't believe anybody in the committee is saying that we should stop the COVID study. What we're saying is, at this time, from the lens that we're looking at COVID at that time, we've got the information that we needed. We're going to get an update and then we move on. In the meantime, let's change the lens that we're looking at the COVID. We can definitely take a lens of looking at children. And we can definitely take a lens of looking at COVID from children mental health. So that's still part of the study. And it also supports what our colleague, Mr. MP Davis, is saying that, hey, look, we got 1,000 things that we can talk about the COVID. So I think there is a general agreement between all our colleagues that we continue on COVID, but we look at it periodically from a different lens. Now, having said that, I have heard over the last, half an hour, about 6 different themes that we've talked about that I just want to quickly tell you where my thoughts are, and we move on. So first theme I heard was, let's continue on COVID, come back and have the officials come, and I think our colleague MP Vancouver talked about May 2nd. So on that, point number 1, I agree and I support. Then we heard about the fact that we should ensure that we are in a position that we could start giving the analysts enough time to be able to pull the report for the human resources. On that one, I agree. The implication is we only have 2 more sessions on that report, and it will give them ample time to be able to pull the initial report, do it, the translations, and so we could look at it. That gives us at least 2 sessions or 1.5 sessions to be able to look at the report and make sure it's there for you to be able to submit. Therefore, on number 2, I definitely agree with what MP Barrett brought up. Now, we also thought, at least the way I understood it, that refocusing or repurposing or looking at the COVID lens with a different lens, which I've already talked about, that we could look at it from a children lens, we can look at it from mental health lens, etc. So on that one, I agree, because I think we've got whatever we could get from that specific lens of COVID. I also believe we're going to get 2 PMB. At least the data so far strongly suggests we're going to get 2 PMB. One is on opioid on the NDP side, another one C224, which is on the liberal side that's coming in. So those studies, depending on when it comes, it's going to come to our committee, and it has to get scheduled. I believe when we vote on them, and it's going to go to vote probably either on the first Wednesday we're coming back or the second Wednesday we're coming back. So those are going to go probably late May, early June. That's going to be referred if they're coming to this committee, and we need to be able to schedule it. Now, on the focus on number 4, on the focus on the children, and specifically on the mental health, you know me, I advocate for mental health, so I support it. Also, I definitely support the hotline as a number 5 item. And lastly, I think there is an opportunity, maybe opportunity for us for two, probably 3 sessions, depending how the report goes, on the human resources, that we could either take an NDP study or the block study on the medical devices. Thank you.
Thank you. Mr. Johari, Ms. Cito, please.
Thank you, Mr. Chair. I agree what Majid or Mr. Van Koevoeten said earlier. It seems that the member want to proceed with the suggestion that we should be flexible with our topics as we move forward with the other topics like children's health. And I think it's also important that we look at breast health, but this is a different topic, that the specific regulatory question that Mr. Terrio had in mind when he introduced it. And I hear that Mr. Davies also has it on his agenda. That sounds like another topic, but we can all get behind, and maybe we could aim to have a report done for October, which is Breast Cancer Awareness Month. Next, we can always come back to COVID if we need to. But I think a lot of us agree that we could pause that for a little while. And Mr. Davies mentioned that he had important topics he would like to hear about, so we can come back to the next time and we revisit it when he presented that. So I think we have some room with our schedule when we come back. But we need to decide from the agenda items we have in front of us before we really consider new topics and see if we can pass this calendar as it now and continue to be flexible when come later.
Thank you, Ms. Cito. Mr. Barrett.
Yeah, thanks very much, Chair, and I am glad to hear the comments from all of my colleagues. So with one exception, I'd like to support the calendar as it is, and then we can reassess as we need to, which is the committee's purview at all times. And that's with respect to the dates on April 25th and May the 2nd. So on April 25th, currently it's the HR study, and on the 2nd, it's a COVID meeting. And I would propose, if there's any visible consensus that can form before I conclude my remarks, and if so, I would then move a motion, but that we swap May 2nd and April 25th, because the clerk tells me that there are no witnesses scheduled for April 25th at this time, and that for May the 2nd, that we invite Drs. Tam and New as a committee, not as the Conservatives, sorry? For the 25th, that we invite Drs. Tam and New and any and the other officials that they would like to bring with them if they so choose, to provide the committee with a COVID update. And then on May the 2nd, we would have the HR study. So if that's something that is amenable to committee members, then perhaps we can do it by consensus, Mr. Chair, and I don't even need to move a motion, just to make that change to the calendar.
Sorry. Finish your comments there, Mr. Barrett.
Oh, okay. I'll go on all day if you don't interrupt me, Chair. So, so I was just looking for that consensus. So, and it looks like there is a bit of consensus, and that is that.
I want you to hold off before you seek consensus, because I want the committee to be aware that if the meetings of April 25th and April 27th are not the last two meetings on the workforce study, so if we go past April 27th in terms of giving drafting instructions to the analyst, we will not be in a position to table the report in June. So if we have consensus to finish the workforce study after the 27th, everyone needs to be aware that that means a fall tabling of the report. And if that's what people want, that's fine. But I want you to know that before you determine whether we have consensus on the point.
Well, then if I can, Chair, then with that context, I appreciate it. And then I would just ask then if the committee could invite our top docs from PHAC for that May 2nd meeting, for, as was discussed by members of the committee. That said, for today, having heard from everyone, I think that for today we can move ahead with the calendar as it is and adjourn.
Okay, well, we still have at least one person on the speakers list, but so we're not going to move adjournment right away, as attractive as that may seem. But do we have the consensus of the committee to follow the calendar on the 25th and 27th, which would mean the last two meetings on the workforce study, and then have the COVID briefing on May 2nd with Dr. Tam and officials? Is there consensus on that point? Do we need a formal motion on it? I see thumbs up, and I'm looking to... Okay.
Mr. Chair, can I just clarify?
Yes, Mr. Davies.
Is the suggestion that if I understand Mr. Barrett correctly, that we're all in agreement with the calendar as is, but for that change, which is to have Dr. Tam and Dr. New on the 2nd? Do I understand that to be the case? Or are we just dealing with that one issue? I'm unclear what.
I think that is it. The problem, Mr. Davies, with adopting the calendar as presented is that there's a couple of options further down where we say COVID or children's health. So I think what Mr. Barrett has put forward would certainly make it crystal clear what we're going to be doing for the next three meetings, without a doubt. Once you get past that, when you get to the 4th of May, when you get to the 4th of May, you see an or in there. And if we were to only do children's health, there would be a chance that we could present the children's health report in June. There's certainly, it doesn't appear, I'm not hearing any appetite to stop hearing about COVID. The only question is whether it's 50% of the time or less. So I guess my view is that if we adopt the calendar as is, that does still merit further discussion as to how much of our future business is on which side of that or. Is it COVID or is it children's health? But I do think that Mr. Barrett's suggestion certainly gives us clarity as to the next three meetings. And now with that we have a speakers list. Did you want to respond to that, Mr. Davies, before I go back to the list?
Well, that's very helpful. Thank you. I just a brief response. Yeah, I maybe Mr. Barrett can clarify that. I see. I agree with you. I think we do need to make a couple more decisions, but I'm still left with this idea that if the Conservatives want to hear from Dr. Tam, they could call her as a witness. So that's why I'm a little confused and why the issue of dedicating May 2nd to Dr. Tam, allocating a whole meeting to Dr. Tam in the absence of determining that we're going to have one meeting in each of the successive weeks on COVID is linked to me. Now, if Mr. Barrett says that that's okay, that if we can agree that the rest of the calendar will have one meeting on COVID each week after that, then I would agree that we could have Dr. Tam and Dr. New on the 2nd. But if that's not the case, then I would probably not agree to the May 2nd proposal.
Okay. Thank you, Mr. Davies. We're going to go now to Ms. Thériault, s'il vous plaît.
Yes, Mr. Chair. I waited for a while before speaking to this to see how we could, in a way, summarize all of this. And I, at the same time, had the opportunity for my colleague to take my place. I was fearful that he might leave in a rush. But in fact, I've attached him to the chair. And Don is right. At times, we have adopted a plan. I remember Mr. Berthold used to say, and that's why it's there in the work plan. He used to say, I don't want to spend all the time until June on my study, he said, but we could have one or two meetings on the pandemic, on health issues for children, which would give us more studies on more time for our studies on children. I think we have to remember what we discussed, because at some point I feel we end up wasting time. And if I could suggest one thing before I see you again in the fall, with respect to the pandemic, I know that at first we didn't want to proceed this way, but every meeting at every subject could be discussed at every meeting. Perhaps at times it would be worthwhile for us to have one or two themes, or one theme, so as to have some witness capacity. I think that would also help the analysts in their work. If the territories, the provinces, and Quebec do away with public health measures, to me, I think it means we have to really call into question some themes, and what we do need to address specifically would be the endemic or endemicity issue. That's what I wanted to say. I think we need to adopt this as soon as possible so that we may begin or continue our work, adjusting along the way.
Merci, Mr. Thériault.
Thank you, Mr. Thériault. Mr. Lake.
So I'm just going to say, try and be as quick as I can. It seems to me that we have an agreement for the 25th, 27th, and 2nd. Beyond that, there's no real consensus yet, and we could probably talk for 7 hours without getting a consensus beyond that, but we have consensus on the next 3 meetings. And we also have a steering committee who can meet offline. There's 2 break weeks. They can meet on Zoom and have a conversation and find some agreement on that, so that we don't just sit here, interminably, second time I've used that word. So I move that we adopt the calendar as presented for the 25th and 27th of April and the 2nd of May. Full stop.
Okay, thank you, Mr. Lake. The motion is in order, I guess, with the clarification that the 2nd of May will be Dr. Tam and officials on a COVID briefing, because the 2nd of May, I think, it gave us 2 options, so we're committing to one of them. Yeah. Okay, so we have a motion. We have thumbs in the air. I believe we have consensus. Very good. The motion is adopted, so we have a clear path for the first 3 meetings. Okay, colleagues, and let's see. All right, no further speakers on the list. There might be a couple of other things that I want to raise, but I think we're
Mr.
getting
Chair, I actually
close
do have
here.
Mr. Lake and Mr. Davies on our list.
Oh, do we? Okay. Are we back to Mr. Lake? That motion's adopted. Mr. Lake.
I move we adjourn.
That's not debatable. Is it the will of the committee to adjourn the meeting?
Yes.
We're adjourned. Thanks, everyone.